Hey everyone, it's Dr. Angela Kudger with Legacy Holistic Health Institute. And in today's evolution of health coaching, we are going to go through some myths and some different updates as they relate to the health coaching industry. Now, as soon as you jump on this live stream, let me know where you're coming from and let me know what it is that you currently do. So, whenever you catch this video, this is probably going to be the video that you're going to save and possibly come back to when you're interested in the information about health coaching. So today I'm going to go through 10 specific myths about the field of health coaching because there's a lot of information about the field of health coaching. It has changed so much since the 1990s that it makes sense to do an updated video about all the different myths that are going around health coaching and to give out the right information. So you're definitely going to want to save this video and come back to it later on when you're looking for the information about health coaching itself. All right, so let's go ahead and let's get into the different myths about health coaching. The first myth that's out there is that health coaching is the same as personal training. Now, although some personal trainers have some attributes of health coaching, it's important to remember that health coaching goes way beyond exercise and it goes beyond fitness. So you may see personal trainers who have some skills to be able to coach and assist in behavioral change, but these two are non-mutually exclusive, right? So personal trainers usually go through some form of certification program, and that is kind of the same as the way health coaching is set up in its education. Some personal trainers actually go through an entire bachelor's or master's degree in kinesiology, and then they use their skills to do personal training after they graduate. Well, in health coaching, it can possibly be the same. So some people might get a master's in health coaching as well, but the key difference here is that exercise and movement is not typically taught in health coaching. So if you're looking for a health coach that is going to help you with your fitness journey, then you may or may not find that. Now, they may be able to give out some tips on the best types of movement, body style. They may be able to give out information about the best types of self-care that might involve movement. But health coaching is not in and of itself personal fitness. Both professions learn a lot about the physical body and how the physical body moves and how it works, but they are not the same at all. The other key difference between, and we'll get into this a little bit later, but the other key difference between health coaches and personal trainers is that personal training or hiring a personal trainer is not typically covered by insurance. And so typically the services of a personal trainer, they are actually paid out of pocket for each one of those sessions. Now, you might pick up sessions in a package, and there might be different kinds of personal training out there. But when it comes to health coaching, in many cases, health coaching is covered by insurance. And we'll get into a little bit more of that a little bit later because that is another myth that is out there. So if you're just now joining me, let me know who you are and let me know where you're located and what you actually do. Over the next time that we have together, we're going to be going over some different myths about the field of health coaching. So you're going to want to save this video because it is going to be your end all be all source concerning health coaching. And you're going to want to make sure you refer back to this video anytime you have any questions. Now, health coaching has been around since the 1990s. So there's a lot of things that have actually changed about health coaching. And so it's important that we understand how to get beyond a lot of the myths that are floating around about health coaches and what health coaches actually do. So let's go ahead and let's look at our next myth. So hi, Malika. Thank you so much for joining us. Thank you so much for joining us, Malika. Welcome, welcome, welcome. We appreciate you for being here. And so let's go ahead and let's look at the next myth. Now that we understand that health coaching and personal training are not the same, the next thing I want us to realize is the myth that goes around that health coaches are just motivational speakers. One of the things that I want us to understand is that health coaches are trained in what is called motivational interviewing. They can tend to be people who naturally motivate other people or people who naturally inspire other folks. And so it's not uncommon to see health coaches offer assistance in the form of motivational speaking. You see how those two come together, right? So we have to remember that any field or expertise that we're in, if you label yourself as a coach, sometimes people automatically lump coaching and motivation together, coaching and help me get started together. But we must understand that health coaches are specifically trained in a type of motivational interviewing. And it's one of the skills that is unique to health coaching and even some of the other counseling or mental health industries. This is a style of speaking and talking to a person or holding a conversation with a person that allows them to then open up, be inspired, and understand what their next steps are and understand how they are going to be supported on their journey. All right. So, yes, health coaches can be motivational speakers, they can be authors, they can be different kinds of experts in certain kinds of fields. However, they are not just motivational speaking. So, if you hear a coach, a health coach on stage as a motivational speaker, just know back of that, there's so much more that they know and that they're able to share with their knowledge. Okay. So, hey, Malika, thank you so much. All right. And so it's great to have you here as well. So let's go ahead and let's look at myth, right? So now we understand that health coaches are not personal trainers. They are two different people. One is covered by insurance and one is not. Health coaching is covered by insurance. And as far as I know, personal training is not covered by insurance unless they're going through some kind of rehabilitation or something like that. The next myth was that health coaches are just motivational speakers. They tend to inspire and motivate, but they are so much more in their expertise than motivational speakers. The next thing that we want to look at is health coaches only help people with serious health problems. This is not true. So, one of the things that we do at Legacy is we have a few different categories on the types of people that our students can coach, and we give them kind of a guide to understand which people are going to be the best kinds of clients. So we kind of have a let's go column and an oh no column. And so it helps the coach understand as they learn to practice, it helps the health coach understand that there are certain types of people, pretty much anybody can get help from a health coach. However, there are certain kinds of people that are kind of at our limits. And that could come from either end of the spectrum. So you could have people who are doing fine. They can do a lot of things on their own. They are naturally self-starters, and they just might need a little bit of motivation. When or if they start working with a health coach, they might immediately start to see that they can do some things on their own. That's kind of the end of the spectrum where the coach needs to kind of release that client and let them be empowered on their own or decrease the number of sessions that they're actually having. The second end or the other end of that spectrum are individuals who are newly diagnosed with different kinds of disease processes, who actually have acute health issues like high blood pressure or new onset diabetes or things like that. Those individuals can health coach, but the health coach must be in contact with the different specialists that are also working with that patient or with that client. And so these are two different ends of the spectrum that allow health coaches to see that I can work with anyone in between. So you have health coaches that specialize in cancer and cancer patients, cancer survivors. You have health coaches that specialize in people that have memory challenges or Alzheimer's. You have health coaches that specialize in diabetes prevention. And so health coaches can work with people are completely healthy that want to just kind of get back on the horse. They want to start eating better. They want to find out the different things that make them sluggish or that make them tired, or they want to make sure that they're eating, or the shopping for their family is in order, how they feed their children, how they feed their spouse, how they work with the people that they're caregivers for. So health coaches can work with these individuals. Health coaches also work with organizations that don't do any kind of catering to anyone who is sick. So they can work with federal government organizations like the Army, like the Navy, where those individuals are not ill at all. They're in great health. They still need someone to help motivate them. They still need someone to help them eat better. And they want to work with a health coach to help them maintain great health. So we have to make sure that we're looking at health coaching as something more than just working with people that might have serious health issues, right? There are people that have mental blocks. There are people that have brain fog or attention deficit, and they don't understand that working with a health coach can help this tremendously when they shift what they eat, when they shift how they hydrate, or when they shift how they deal with foods that might inflame their system. And so we must understand that thinking that health coaches are only for sick people, no, that's just not true. It's a myth. There are a lot of very, very healthy people who are doing very well because they work with a health coach or they have a health coach in their arsenal. Hey, Marie, thank you so much for joining us. Hey, hey, hey. And so, for those of you guys who are joining us, wherever you are, let us know who you are and what you actually do. So, where you're from and what you actually do. Okay. So, drop that down in the comments so I'll know you guys are here. And as I'm debunking these 10 myths, you guys let me know if you have any questions about any of these. Okay. All right, so let's go to the next one. Next one is a big one. I really like this one. Okay, I ask this question all the time. Let me take a sip of water real quick. All right, so I get this question all the time when I talk to prospects, and there are even some people who graduate from health coaching programs. There are hundreds of thousands of health coach graduates in the United States. Okay, and so the myth that health coaching is not a legitimate career is just wild to me. Health coaching has been around since the 1990s. People in states like California, Nevada, Arizona, Texas, people in these kind of states have had private practices in health coaching for decades now. Okay. So is it a legitimate career move? Absolutely. Is it the best career move for you? Totally depends. The majority of people that work in health coaching actually work remotely. So they work in telemedicine, they work alongside doctors in doctors' offices sometimes. They tend to make their own schedule in many cases. They're like on staff with another team. Most of them make their own schedules and most of them work in some kind of private practice because they find it easier to guide their clients in this way. And so we want to make sure that we understand what a legitimate career is. When I think about an illegitimate career, I think of, like, to me, life coaching is an illegitimate career. There's no governing body. They don't have to take any exam to be a life coach in most cases. There's no type of standard for the types of people that train life coaches, meaning that they don't have to have so many years experience in life coaching. They don't, to me, that's kind of like an illegitimate career. If you're just really, really great at it, and I say this because I'm a certified life coach too for many, many years, but it's not really governed by anything, right? It's not really regulated in any kind of way. Whereas health coaching is regulated. There is a national board certifying that license the health coach when they graduate that they qualify for. There is a standard for the type of people who teach health coaches. They must have a master's degree or higher in some form of health related field. And if they don't have that degree, they have to have so many thousands of hours in some form of field that is related to health coaching. So you can't just be some regular person and teach health coaching. It doesn't work that way. So it's highly regulated at the national level, and there's an exam that actually certifies health coaching. So when we look at what are the characteristics that create a legitimate healthcare career, you want to make sure it has a governing body. You want to make sure that the people who are teaching the different courses also regulated and held to a certain standard. And then you also want to make sure that not everyone can just pass the exam. So it's very, very legitimate, if I say this, okay? And so over the years, it has been governed by the American Medical Association, and the board exam, although it is scheduled by the National Board of Health and Wellness Coaching, it is distributed or given by the National Board of Medical Examiners. So NBME is the organization that distributes the exam to most, if not all, medical professionals. That means doctors, that means nurses, that means CNAs, that means phlebotomists. The majority of these people go through the National Medical Board, and so do health coaches. So yes, it is a very legitimate career field, and it has come a long way over the past 3 or 4 years, I'll say. Even though it's been around a long time, it's become much more related here since the pandemic, and they've learned the skills that health coaches have to prevent disease and things like that. So is it a legitimate career? Freaking absolutely. Have you looked at it as a real career? If you have not, you absolutely should. If you're already in the field of health coaching, it's time for you to start looking at some different options to move yourself up the ladder in your career. Okay. All right. Let's look at the next myth. Health coaches only focus on food and exercise. Ain't no way, right? I gotta say that. Okay, so health coaches only focus on diet or food and exercise. Now, before I debunk this myth, I'm gonna preface this by saying there are some health coaching programs that only focus on food and exercise or exercise or one specific way of living, being, learning, becoming, right? Healthy. And so to that, I'll say you must know what is actually in a program. And so we have a download that you can get, and you just got to let me know if you want that download. I'll get that link. But we have a download so that when you're looking at programs, there's a checklist of the things that they should be telling you that they do or that they know, if that makes sense. And so I always tell prospects, if you're interested in the field of health coaching, you must be very clear on the knowledge that you want to have when you graduate. You must be very clear on where you want to land as a health coach. Although there are standards that programs must adhere to, those standards can tend to be very, very light. And some programs do not focus on anything outside of nutrition and exercise. Make no mistake, nutrition and exercise play a huge role in longevity. They play a huge role in overall health and well-being. They definitely have their place. However, our behaviors, the things that we focus on, our mental capacity, our mental health also play an even bigger role in our overall well-being, our social circles, right? Our intellect, our knowledge about health and wellness, and the people that we are around play a massive role in whether or not we will maintain our health and wellness and if we'll stay healthy long term. And so when we're looking at debunking this myth, health coaches are taught so much more than diet and exercise. They are taught behavioral change. They are also taught things like anatomy and physiology. We go even further than that in the program at Legacy, and we actually teach the energetic system or the chakra system. And so, health coaches should know way more than just food and exercise. If you're around health coaches who only focus on these things, that might be something that they're comfortable focusing on, but their teaching was on many, many other concepts. So keep that in mind. And so this is a myth that that's the only thing that they know. There's so many more things out there that health coaches are aware of and that they can teach and assist with other than food and exercise or other than diet and exercise. Now, another myth has to do with affordability and the expense of hiring a health coach. And so there's two different schools of thought here. So one would be that going back to school for health coaching is expensive. The average tuition rate, because health coaching has come to where it is and people have the ability to do so much more when they graduate as a health coach, the average tuition for these programs is going to sit between about $5,000 up to about $10,000. And that's for a short-term certification. If you're looking for something that is going to be like a master's degree, obviously for a master's degree, you're going to pay way more than $10,000. And so keep that in mind. The average health coach typically earns anywhere between $45 and $60 per hour for those individuals who are new health coaches or those people who are just now entering the field and they take a job. That means they get hired through some kind of organization. The low end is about $45 an hour. So I always tell people, when they say, I don't know if my investment, and I always tell them, with the degree that you currently have, if you've gone to school or with whatever certification that you currently have, are you earning more than that $45 to $60 per hour? If you're not, then you know that going back to school for health coaching might put you in a different space financially, as well as allow you to work virtually. So keep that in mind. And I always tell people also when they say, well, I wonder if clients are going to have the money to hire me. Well, the good news is that health coaching is covered by insurance, right? And so in many cases, a lot of the private insurance companies now cover it, but now you also have Medicare and Medicaid that actually covers health coaching services too. So when you think about whether or not someone would be able to afford your services, well, it's not really any money out of their pocket if they have some form of coverage. If they don't have insurance, then as a practitioner, it's customary for you as a health coach to offer some form of sliding scale payment that will allow them to stay within their budget and still use your services. Okay. Let me know if you have any questions about that. So that's on the side of whether or not people will be able to afford your services. And also keep in mind that insurance billing is state regulated and it's based on where the coverage of is. So if the client lives in Georgia, then their insurance coverage in Georgia is going to be a different rate than their insurance coverage if they lived in Texas. So your pay for a client in Georgia might be very different from your pay for someone that lives in LA or that lives in Texas. The coverage or the reimbursement for your hour of time is different. And those numbers are so different across the board that it's challenging to say, oh, if you coach someone in LA, this is how much you'll get paid an hour, versus if you coach someone in Atlanta, Georgia, this is what you're going to get paid an hour. Very hard to say that because it's always regulated by the company. So it depends on what company they're covered with, the nature of the service that you provide as a health coach, and it depends on what that insurance company actually covers under your health coaching. So the same way you would find certain medications aren't covered under a certain plan, it's the same thing with health coaching. Certain services are not covered under certain plans. And so keep that in mind. But most health coaching, nutrition therapy is covered by insurance in, to some degree. Okay. Now, when it comes to whether or not you can get financial aid, so let's talk a little bit about the expense and affordability as it relates to your ability to go back to school to become a health coach. Now, that coverage might actually be done by your employer. So there's many different ways to get your program or your tuition covered, right? Some schools like ours offer scholarships. Some institutions actually do take the GI Bill. So if you are someone who gets benefits as a veteran, if you're someone who is a veteran spouse who receives educational benefits, you may be able to use those as well. What you might also find is that not all schools offer military discounts, right? If they can accept the GI Bill, it's highly unlikely that they will accept some form of military discount or they will extend some form of military discount. It's just not the norm in these kinds of programs. There is also tuition reimbursement by employers. And so there are a lot of people that have come through this program from companies like Google, FedEx, UPS, some of the larger out there, or the more established companies that had tuition reimbursement will actually cover the educational expense of the health coach. Now, there might be some specific stipulations that go along with when they cover your tuition. Some of them might say, well, you have to work at this establishment as a health coach to help the employees. So you might find that in that tuition reimbursement, there are also some rules you have to adhere to for a certain amount of time. Vocational rehabilitation, or for those individuals who have received things like SSI or some form of disability payments, their tuition is usually covered by the state as well. So if you're someone, you know someone who's disabled or who has received SSI and they want to get back into the workforce, but they want to do it virtually, the state will definitely cover their entire tuition. And in some cases, they might cover their board exam expenses as well as their continuing education expenses to keep their license or to keep their certification up after they graduate. There is also different grant programs out there, as well as scholarship programs that will cover tuition of these programs. So as you can see, when you really start to look into this, the affordability, there are ways to get your tuition paid for completely. And there are ways for clients to then be able to pay for your services once you are a practicing health coach. Okay. That's another myth. Another myth is you need a medical or healthcare background to become a health coach. Excuse me. So let's see. How can I put this? This is such a myth. There are programs out there like ours that will teach you the anatomy, that will teach you medications, that will go into detail about diagnostics, chronic disease processes, prevention, scientific dietary theories. All of those things are covered in your program. Health coaching programs, most of them only require that an individual be at least 18 years or older before they enter the program to be able to coach. And this just makes sense because we want people of some form of legal age that is giving out advice or assisting people with the health of their physical body. And so you only have 18 years to be a part of a health coaching program. And people from all backgrounds, all different walks of life, from real estate to engineering, all types of backgrounds go back to school for health coaching. So you don't ever have to have some form of medical degree to be able to be a health coach or have any health related background. Usually, the program is going to cover the extent of the information that you need to know concerning health, wellness, and disease prevention. And again, some of this has to do with the program that you choose, but for the most part, you're not required to have any kind of background in health and wellness or health care. Now, I will say if you are someone that knows that you like health coaching and you're interested in actually teaching health coaching when you're done, then you absolutely are required to have some kind of background in healthcare or a health related field. But that's for those people who want to teach when they graduate. For everyone else who just wants to practice as a health coach, that background in healthcare is not necessary. As a matter of fact, most health coaches in the United States are not people in healthcare at all. And so you'll see that the majority of these people come from different types of fields that are not directly related to healthcare or health and wellness. All right. So another myth is that it's a fad and it won't last. Not likely. Okay. They are building AI mechanisms for health coaching now. It's definitely not a fad. This is a myth that sometimes people lump health coaching into like life coaching. Totally not the same. Again, there is no real governing body over life coaches or life coaching programs. Anyone, anywhere, with or without any form of experience, can start a life coaching program. Not the case with health coaching, like at all. Even if you're a federal organization or even a state organization, you still have to be regulated if you want your health coaching program to be available to those individuals to attend it. Now, as far as it being a fad, one thing we have to remember is that the federal government in the United States does not buy fads. The federal government in the United States does not buy fads. They have repeatedly bought health coaching in very high dollar amounts to implement health coaching throughout the federal systems. This includes the VA and the Department of Health and Human Services. And so these are some of your larger bodied federal organizations that govern hundreds of other organizations underneath them. And so we want to make sure that we understand that nobody is spending money on a fad, right? And so wherever you see the US government starting to allocate dollars and spending, you better know that there's something about what they're spending the money on that is going to be around long term. Okay. So, no, it's not a fad. And in some states, it is also considered a high demand career field. So, you want to keep that in mind as well. Health coaches are also looked at, or they are also considered allied health professionals because they add value to the patient's journey that no other healthcare provider can actually add or is trained to add in this instance. And so they add tremendous value to the patient's life or their lifestyle, but they also add value to organizations that choose to use health coaches. And so we want to make sure that we understand that health coaching has come a long way and it's now rooted into how we do healthcare, not just here in the United States, but in some cases abroad as well. All right. Another myth is that health coaches can only work in private practice. Not true, right? I really want to debunk this myth because there are some health coaches out there that live really, really well. They have found ways to get multi-million dollar grants to help specific types of patients. They have found ways to collaborate with healthcare organizations to work closely with their patient population. They found ways to be able to assist in communities that need their expertise, healthcare systems that need their expertise. So health coaches don't just work in practice. A lot of them work for organizations directly. The VA, I know for a fact, is still hiring for health coaches, and those individuals who have gone through an approved program qualify to be able to apply for those jobs with the VA. There are health coaches that are hired for the YMCA, YWCA, the organizations like DaVita Dialysis. They also hire health coaches in places like Walmart, CVS, Rite Aid. And so anywhere like where there's drugstores or a pharmacy or a health section, a lot of those individual places offer health coaching positions. So it's not just them striking out on their own, working in their own private health coaching practice, but many of them also work alongside or within community-based organizations, healthcare organizations, nonprofit organizations, and health systems, and federal and state organizations as well. And so that is a myth that should definitely be debunked. But people are almost always like, well, what am I going to do when I graduate? Where can I work when I graduate? You have to be diligent about finding the opportunities because they are out there. There are health coaching sites that operate or act as like job boards, but you want to be careful with things like that because there are some remote job boards that actually make you pay to see the opportunities, right? And so you want to know that these things are posted free on Indeed, Glassdoor. LinkedIn is huge for health coaching position postings. They are posted on federal websites. They're posted in a bunch of different places. And so these announcements of jobs and the ability to apply for these jobs as a health coach are free. So you don't want to go with an organization that's making you pay to have access to jobs that are out there for health coaches if you've completed a program. Now, the last myth that I want to talk about before we get into kind of the future of this, right? Because this is about the myths and where health coaching is going in the future. The last one, and this is a great segue into that, is that health coaching is not covered by insurance. There are people, so this is the myth that health coaching is not covered by insurance. The truth is it is covered. People just don't know how to do it. They don't know how to get it covered. They don't know how to find out how to get reimbursed. They don't know how to get money out of their services from insurance companies. Now that's a completely different feat, right? And once the person understands that, they can quickly see that one patient you might get reimbursed, $50 for an hour of your time with one patient, whereas with another patient you might get $250 an hour based on their coverage. You'll end up getting this wide range of payments or coverage for the same types of services. And this can be extremely lucrative for a health coach who is deciding to be in private practice, help to work with other organizations that bill insurance for their services, might typically be paid a flat fee, but the services are certainly reimbursable. And so you'll find the myth that people will say, oh, well, health coaching isn't covered by insurance, when the reality is that they just don't know how to reimburse. They don't know how to get paid for it. There's a process to submissions. And I will say, over the years, this submission process for reimbursement and for claims have gotten much more advanced to the point where most organizations you can actually submit your claims online. So just like a person can go online and upload everything that they did, their notes regarding the session, and then that organization will go ahead and reimburse them for that service. Now, the other piece that I will say is that is why people think that being reimbursed from health coaching insurance reimbursement is a myth, is because there is a process for those individuals who want to be reimbursed to be listed as a provider. And again, that process is free. This is called credentialing. And since health coaching is a new field, so to speak, and when I say new, I mean less than 50 years old, right? So like nursing, respiratory therapy, phlebotomy, um, medical doctors. These are fields that have been around for a very, very, very long time. And so what they actually do in practice has been able to be followed and streamlined so that it can be a billable item. It can be a line item of a service that they offer. Health coaching is very new. And although we have a standard in place, you still have schools that teach very different things concerning health coaching, to the point where coaches might be distributing services that are a little bit different from one another. And so those line items, right, that they send in to get reimbursed have to over time be standardized. But the more health coaches who graduate and start to seek out being listed as a provider with insurance companies, which is free to do on the insurance provider's website. So on Blue Cross Blue Shield, on many of these websites, you can go and list yourself as a provider on these sites to see if they will approve your services, and then you can start the reimbursement process. So claim submission, insurance reimbursement, that's a whole beast in and of itself. And so instead of people hiring companies to do this for them, working alongside other medical organizations that will do this for them, or learning how to actually do this for themselves, they'd rather pass along the myth that says health coaching is not covered by insurance. Well, that's a lie. It is covered, and there are a lot of people getting reimbursed now. Health coaching is also covered through HSA and FSA. These are your health savings accounts, and these are flexible spending accounts. And this information, those individuals who actually are using these benefits, these come in the form of like a debit card. So a person can use their card that is connected to their health savings account or their flexible spending account while they actually work with the health coach. So it makes the process of collecting payments for your services as a health coach seamless and simple. And in that case, you don't have to be listed for a provider. So you could totally be someone that says, I only take HSA and FSA and get paid in that manner. And that's a very simple, straightforward way to get reimbursed. But it's definitely covered. There's just still very little information on how that process works. And so you'll have people just kind of throw out the myth and say, oh, it's not covered by insurance, when what they're really saying is, I don't know how to get paid from it. But there are people getting paid. Okay. And so with that being said, I want to kind of go into detail, not into detail, with the time we have left, I want to talk a little bit about the future of health coaching. Now, you guys have seen the different apps and things like that with like, I guess a good example of this would be like a Weight Watchers app or like a Noom app, which both of these organizations offer health coaching, but they've also both entered into the weight loss pharmaceutical industry. And so they're starting to step a little bit more away from behavioral change and embrace a little bit more medical or medicine intervention, Ozempic and all these other things, as it relates to sustainable change and weight loss. And so because some of the big conglomerates in the wellness and health space are kind of sideways to go towards the medical or pharmaceutical space, you're going to start to see the space of health coaching get way more innovative than it's ever been. And that includes implementing things like artificial intelligence, matchmaking for health coaching, early diagnosis or disease prevention, not solely with the use of a health coach, but with some of the expertise of what coaches can provide. So you'll start to see this field get much, much more innovative. Even though it has been moving slow, you're going to start to see it speed up here in a little bit. And so if you are someone who is interested in health coach training program or being part of the program here at Legacy, you want to make sure that excuse me, that you reach out and you let us know that you're interested in enrolling. This will allow you to get information about the things that make Legacy very different. Our program flows in the way that insurance billing flows. I built this program that way from 2018, long before we were able to get reimbursement. I just have always known that that's the direction that the field is going. And so, if a person is wanting to specialize in certain things or understand specific disease prevention or chronic disease concepts, you want to make sure you're in a program that actually is teaching it. Also want to make sure that if insurance reimbursement is kind of the wave or the innovation of the future, you're in a program that teaches you enough to have something worth in reimbursing. And that's another big challenge that is the reason why people say health coaching isn't reimbursable with insurance. In many cases, they're not coaching in a way that will allow them to submit anything for insurance. And so you have to get into a program that is allowing you to understand anatomy and physiology. That's huge for insurance billing. That's allowing you to understand disease and chronic disease concepts, which is right into alignment with insurance. How are you going to get reimbursed if you don't know what you're helping someone with a chronic disease do, right? And insurance companies know if you're not doing any of that kind of work, your notes are going to tell that you didn't do that kind of work. And so we want to make sure that you're in a program that's going to not only give you your money's worth, that's going to be in alignment with market rate, but give you way more than you'll receive from some of the other ones on the market out there, some of the more popular ones that lean heavily into nutrition therapy or nutrition theory, and they don't lean anywhere or offer any anatomy, any physiology, or anything concerning disease. And you know you'll need to know that stuff in order to reimburse and really get paid top dollar as a health coach. And so if you're interested, cohort 45 starts August the 29th, and that class will be every Thursday from 6 to 8 p.m. Eastern Standard Time. If you're interested in enrolling or you want to hear about the different plans to finance your education or finance your tuition, or understand what the payment options are and the scholarships that are available, make sure you send enroll to this number that's coming across your screen. Let me know if you guys have any questions about any of the myths or anything we've covered. I personally am, health coaching just excites me, right? Everything about it being a new field, a field that's up and coming, a field that has grown faster than they could have ever imagined that it would grow. I am so ecstatic. I have so many other incredible ideas to help advance the field. And I know those individuals who are kind of on the fence, they're going to wish they had leaped, right? Because as more people enter the field, you're going to see certain things happen, right? A supply and demand thing, right? And so if you're wanting to be a part of kind of this next 5 to 7 years of where health coaching is going to go to or grow to, you want to make sure that you're connected with a program that's going to give you what you need and that's going to provide that for you early. All right. So if there are not any questions, I want to say thank you so much to you guys for joining me. Again, make sure that you save this video and that you come back to look at these myths if you hear anyone saying the different things about health coaching. And so really quickly before I hop off, I'm going to run through those 10 again. 1, health coaching is the same as personal training. Not true. One is covered by insurance, health coaching. Personal training is not. Personal training is fitness related. Health coaching is behavioral change related. The next one was health coaches are just motivational speakers. Not at all. They can motivate, inspire, and empower, but they do way, 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 way more than that. Okay. They work alongside medical teams for clients. The third one was only people with serious problems need a health coach. Usually, people who are already well and healthy use health coaches to maintain those behaviors or so that they never stagnate or so that they never plateau in their behaviors or in the things that they're wanting to do. Health coaching is not a legitimate career. Not true. It has a governing body. It has a board certifying exam. It's regulated by U.S. Congress, the American Medical Association, and the National Board of Medical Examiners, in addition to the National Board of Health and Wellness Coaching, NBHWC. Definitely a legitimate career. There are standards for people who want to teach health coaching. There are standards for people who graduate from programs and want to sit for the exam. There are requirements that must be met. It is a legitimate career. The next thing is that health coaches only focus on diet and exercise. Now, we talked about this. It depends on the program because some programs, that's all they teach. But if you want a really great program that's going to keep up with what's happening in the future, you better find one that teaches anatomy and physiology, or you're not going to be able to bill insurance, or you're going to be capped at what you can bill for. And you want to find one that also teaches disease prevention, or you're going to only be out here giving information about food, which at some point is going to get old because people want customizable approaches that teach way more than that. The other one is that health coaching is expensive and unaffordable. Not true. Several ways to get your tuition paid for by federal, state, and corporate organizations. And a lot of the services that you will provide are affordable because they are covered by insurance, nonprofit organizations as well. Another one was that you got to have a medical background. Not true. Health coaches can be 18 years or older to enter the field of health coaching. Now, if they decide to sit for their licensing, then they might need some other things. And those other things are like working as a requirement or having some life experience before they can actually jump out and start coaching people or be a licensed health coach, if that makes sense. They can coach as long as they graduate, but in order to sit for the board exam and bill insurance, things like that, there are some other requirements. Let's see here. One is that health coaching is a fad and it won't last. Not true. The last contract for the Department of Defense to implement health coaching was over $600 million. The government is spending large amounts of money on health coaching and to implement health coaches into what they do in terms of therapy, in terms of healthcare systems. Where the government is spending money, you can better believe it ain't a fad. That means they want something that is sustainable and that is going to stay. And it also means if you're looking at other medical fields, these medical fields may not be as equipped as a health coach would be to innovate healthcare in a way that they're looking for long term. So yes, it will last because there's a lot of money being spent on health coaching and to implement it. The other one is that health coaches don't only work in private practice. They work in all kinds of things. Community-based organizations, they work on their own in private practice. They work for doctors' offices. They work in hospitals. And a lot of times corporations are now having health coaches in the workplace. So they don't just work in private practice. If they have been a health coach for a while, then they might strike out on their own and create their own private practice. But that's not all they get to do. They get to do way more than that. And the last one is health coaching is not covered by insurance. You just heard me say it's covered by insurance. The biggest challenge is that people don't know how to get reimbursed. That's the biggest challenge we have. And so as people start to, submit claims and different things to be reimbursed by insurance, we're going to see that process streamlined significantly. And then you'll see a lot more people bill for health coaching. And then you'll see the tuition for these programs go way up because of the billability and the revenue that can be generated from insurance billing as a coach or as an organization. All right. All right. So Malika says, I definitely saved this video. Thank you so much. You are absolutely welcome. And thank you so much. Yes, she says, you are dropping so many gems, and I had no idea that organizations like the VA, yes, the VA, give it probably until January, and then you're going to see the entire Department of Defense. And that means your Army, your Navy, all of that. They're going to start hiring for health coaches as well. You're also going to see those organizations get health coaches in place, not just for servicemen and women, but for their families. And so it's going to be more of a turnkey process where they can call a and have access to a health coach, which is huge. So you're going to start to see that part of health coaching innovate significantly. Okay. But yes, they do hire health coaches all the time. They have, I know CVS has them also at their main clinic. They started doing this probably around the pandemic. And so they understood that there are some behaviors that might keep people from contracting COVID, and it wasn't in the learning or the development of other healthcare providers to have this information. That is when they learned the distinct skill of a health coach to create behavioral change and to prevent chronic disease. And so you'll see a lot of people get a health coach just to make sure they stay out of the hospital. All right. If there are any questions, you guys, let me know. You can put it below this video. If you register for this live stream, you want to make sure that you understand that your name is entered to win a full scholarship. That drawing will be on Wednesday, August the 28th. Let me know that I'm correct about that. It's usually the Wednesday before class. And so that individual will be announced live. And you actually have to be present on the live stream to win the scholarship. Until next time, you guys, next week I'll be with Dr. Tracy. Tracy and I are going to have a really great conversation about family health and wellness and how health coaches become the beacon, the light, the advocate for health and wellness within their communities and starting at home within their families. I love it. So make sure you watch your email to register for that next live stream. Until then, it is always a pleasure sharing time and space with you guys. You know I absolutely love it. And until next time, love and light, y'all. Bye-bye.